Hi, my name is Jamil, and you're listening to Public Health World. Join me as I interview people making a difference in the world and their communities through public health and global health alike. Today I'm here with Omari Richins. He holds a Bachelor of Science from the University of Tampa and completed his MPH at the University of Florida. For almost 3 years, Omari has been working on his own project called the Public Health Millennials. He runs a blog, an Instagram page, podcast, and more, based on trying to get people interested in public health and helping new professionals into the industry. Omari has a passion for health equity through a public health lens. I hope you enjoy the episode. Hey Omari, thanks for being on the podcast. How's your morning in America in this case?
The pleasure is mine. I'm so glad that you reached out, and I'm glad that we can make time. As you said, it is morning time here. It is evening time where you are in Australia.
Day later, sorry.
Yeah, yeah, exactly. But my morning is going well. You know, not every morning I get to start off with a podcast interview, so I'm looking forward to it.
Yeah, definitely. Yeah. So I suppose start off the bat, I do like a little icebreaker occasionally, just to break the ice, so to speak. So I've got two questions for you. One, what is your favorite food?
Ooh, my favorite food. When you say that, the first thing that comes to mind is definitely doubles, which is a Trinidadian food. It's based out of, it's just like Trinidadian, West Indian type food. So it's like,
What is the actual food? Like, what's in it?
do you know? You probably know about like fried bread.
Yeah, vaguely.
So it's similar to fried bread in the sense that you're frying dough, which we call bara, and then there's like curry chickpeas in there. There's like cut up. There's some nice, like there's a sweet sauce. There's some mango that they put in there. There is cucumbers, and it is delicious. It looks like a mess, but it is delicious. So if anyone is interested, just Google doubles Trinidad and you'll see it come up there. It might look a little off-turning, but the taste is amazing.
Yeah. Okay. Cool. And the second one is much more related to public health, and it's, if you could fix one public health issue tomorrow, what would it be? There's unlimited money, anything. Just go for it.
That is a big one, and I guess I guess the biggest one would have to be racism, and to that point also poverty. I think poverty and racism are interlinked, and the issues that we can solve by giving people resources to be more healthy, because we know poverty is linked to a host of poor health outcomes. So ensuring that is there, and as well as racism has been built into society and has built inequities, which I bet we'll talk a little bit more about later in the podcast. Yeah. So I think fixing those two would be the things that I would want to do.
Yeah, cool. Okay, yeah, that's awesome. So now that we've done that, who are you? As I said, like, how do you identify, etc. Same sort of question as you tend to ask as your first question.
Yeah, absolutely. So my name is Omari Richins, he, him pronouns, originally from Trinidad and Tobago, which is a tiny island, the southernmost island in the Caribbean. Grew up there until I was 16, lived in the Middle East for a bit. My family immigrated there. So I did my last 2 years of high school there at an American international school. From there, went on to do my collegiate schooling in the US, so in Florida, and then after schooling, moved to Alaska for 14 months. Then I currently live in North Carolina, but partially in Atlanta because my partner lives there. More about myself. I like football. My teams are Bayern Munich, Arsenal, Netherlands.
So for those who don't know and don't realize, by football we mean soccer. But yes, football is the correct term.
That's funny. That it's funny because the USA and I feel like Australia are the two countries
Four
that
countries.
the
Does
four
Canada as
countries.
well? So
True, true.
Canada, New Zealand, Australia, America, and like not like like USA. That is literally it.
It's so funny that that is the case. Especially granted that USA and Canada and New Zealand and Australia are so far apart.
Mm,
but but regardless, those are my teams also support Trinidad and Tobago. They've been doing a lot better than they have in recent years. So looking forward to seeing the growth of that
mm,
team. A little bit more personally about myself, I like to travel, I like to focus on wellness and things that I do. I enjoy building communities. I like personal finance and investing. I'm an avid podcast listener slash watcher. I watch a lot of podcasts on YouTube, hence why my podcast is on YouTube. Lifelong learner, and I want to be someone that makes their path in health equity and in public health, really creating opportunities and access and for people that like look like me and haven't had those types of
yeah,
opportunities. And I'm a content creator with the public health millennial, which I'm guessing we'll dive into more a little
definitely.
bit
Yeah,
later on.
yeah, no, definitely. Yeah, you're veganish as well. I think you said recently as well, which jumped me right up because I'm fully vegan. So when I saw that, I was like, oh, cool, that's awesome. Yeah. So
Yeah,
yeah.
yeah, absolutely. Definitely try to eat very plant-based. My partner's actually vegan.
What pursued you in that direction? I know a lot of African Americans is very big in the African American community as far as percentage wise goes, and a lot of it's like reclaiming history because like if you look at most like traditional African foods, they're all very plant based. Is that kind of similar to you? Like almost regaining some sort of
Yeah, I like that perspective. So initially, I was a pescatarian slash vegetarian, and I've been that way for maybe 7 years now. And as of more recently, I've been eating more heavily plant-based diets, and I think it is everything that you're saying, as well as I think it's a way of saying F you to the system because I feel like a lot of the food that we have has come from inequitable systems that
mm,
don't cherish the land that it comes from. It doesn't cherish the black land, and it has like if you just look at they because I work with a lot of black farmers and they struggle very much compared to a lot of the
mm,
white farmers, and I think it is about reclaiming that land, reclaiming that history,
mm.
um, pushing away from societal systems that are there and really finding a way for us to reclaim and be our own people. And I think food
Yeah, definitely.
is
Yeah.
the driver of that.
Yeah, no, definitely. Definitely get more into that once we go back down to health equity and all that sort of area. I said like I'm big on nutrition and how it relates to like racism and things like that, which a lot of people don't think of. So I'd love to get your views on some of my thoughts. But moving on from that for now, at least, what's your definition of public health?
Yeah, and this is a great question, and I guess something that I can answer, and I probably will answer in so many different ways, in so many different contexts. But looking at my perspective, I think public health is just a tool and the strategies to work towards a healthier world, a more equitable world. And some would say, well, most people would say it's a science and art of protecting and improving the health of communities. And I think it's important to share that I wanted to improve health, and the only way that I knew about that traditionally was becoming a doctor. But thankfully, I was able to get into public health and learn about this prevention aspect and really focusing on communities and populations as opposed to treating symptoms of disease, but focusing on the root cause. So
Yeah.
public health spans many things from like sidewalks to mental health to transportation to healthy eating, healthy sex and relationships and everything in between. But public health is a tool and strategy that I have gained in my life to make the impact that I would like to make.
Yeah, awesome. Yeah, so kind of going on from that is what drew you to public health in the first place?
Yeah, my story into public health is probably not very unfamiliar to others, or like it's very similar to other people. I had no clue what public health was. I graduated from my bachelor's program, and I was applying for Masters of Medical Sciences programs. I got rejected from three of the four programs that I applied to, and I was just looking for something else to do with my biology degree. And thankfully, I fell upon Master of Public Health programs. I had no idea what it was. And then from there, in 2017, it was just leaning about public health. And I say this to say I've had 100 interviews on my podcast. I think rushing into a degree is definitely not the best path to thinking about, nor was it probably the most healthy decision. But thankfully, it worked out. And I'm thankful to be able to find out about public health when I did and get into public health because I thought it was just so cool.
Mm.
And I was like, why is no one telling us about this at a younger age type thing? And that's what like kind of prompted me to start my blog and start my podcast and all of that, because I just thought this was something that people needed to know more about.
Yeah, definitely. Yeah, no, as I said, public health is everything. Is that saying that people say? So I suppose, how did you get to where you are now? I know that you started at the University of Tampa.
Yeah. So I get, I guess similar to the last question, started University of Tampa. I got my bachelor's in biology. I started off as a pre-veterinary medicine biology degree person, then slowly switched over to pre-med because I just didn't think that if I could be a veterinarian anywhere in the world. I know that people in the US love their pets, but people in other places in the world don't love their pets as much. So just thinking about sustainable living there.
Mm.
And then from there, I graduated in 2016. And as I stated, I was looking to still become a doctor, physician, and apply for Masters of Medical Sciences programs, which are 1 year, kind of like gap year programs before people reapply to medical school. And I was lucky enough to get rejected from the schools there and found myself at the University of Florida, where I got my Master's of Public Health in the concentration of health management and policy. And that was really because I wanted to focus on um, large systems and ways to change the systems, because throughout my bachelor's in biology, we're talking more about microbiology and parasitology and all these very micro stuff. So looking at it on a large scale is something that was exciting for me. And Yeah, so that's how I got into public
Mm.
health. And then after my MPH, I was able to get a community health fellowship in Alaska. And I currently work for the Reynolds Charitable Trust in North
What's
Carolina.
that for people who might not know? Like myself, I wasn't too sure what that is. I found it a little bit hard to find what it was.
The Reynolds Charitable
Yeah.
Trust. Yeah, of course. And it's tricky because even me coming into this role, I had no clue what it was. I didn't know how to explain it to people, and I feel like I still have a difficult time explaining it to people. But the KP Reynolds Charitable Trust is a 75-year-old health foundation. It was started by Miss Kate B. Reynolds. When she passed away, she had no kids, so she willed her money into this trust, which was focused on improving the health and quality of life for low-income North Carolinians. Our work at the trust is really focused on equity and systems change and giving power to communities, especially communities that have been left out and have been disinvested from. And these communities are mostly rural and mostly Black. And one of the projects that I came into to work at the trust was a 10-year initiative called Healthy Places North Carolina. It was a 10-year initiative to invest $100 million into 10 rural counties that are around the state that are vibrant but yet have been underinvested for a long time. And in Healthy Places North Carolina, we do work around ACEs, which is adverse childhood experiences, substance misuse, obesity reduction, which is actually like food systems change and
Yeah.
active recreation. And I also lead work around capacity building. So we are a public health funder, I would say, or health philanthropy funder. So yeah, I don't know if that helps.
A little bit, yeah. I mean, it's definitely more than what I found. I said like the little bit I looked was like on LinkedIn and stuff, and they're very, very short blurb on what they do. And also,
Yes.
sorry, just backing up slightly as well. How did you hear about public health? We didn't actually mention that earlier. So how did you actually hear about public health?
Yeah, so I was just looking for master level programs and seeing what I can do with a biology degree. And just somehow from Google searching, from being in Gainesville, Florida, where the University of Florida is, thankfully they had a Master's of Public Health program. So at first I want to say I found the public health certificate. And then from there, I was like, oh, what's this public health thing? And then I
Yeah.
looked into it some more so that you can do a Master's of Public Health and then
Yeah.
pursued it from there.
Yeah, definitely. Yeah. And the other question I had personally, what is the difference in America between a university and a college?
Oh, yeah, yeah,
Like I
that,
said, like I didn't realize you had universities until quite recently, and I was like, what?
yeah, that's a great question and something that I didn't understand coming into the
Mm,
college like world in the USA, especially being from Trinidad and Tobago.
mm,
Um, but a university is usually, well, I should say a college is usually a four-year institution, so they typically don't have graduate programs,
yeah.
while a university will have the four-year education as well as graduate programs, and
Yeah.
there are probably some other nuances there that I just
Yeah, yeah,
don't.
yeah. Okay, yeah, fair enough. That makes a bit more sense. Yeah. Okay, cool. Yeah, that definitely helps. And just what was Alaska like? What did you do in Alaska?
Yeah, Alaska was really cool. I was really hoping to
Cold.
stay there. Yeah, it was cold. It was cold and dark. Cold and dark. Very, very dark.
Where
During
in
the
Alaska were you?
I was in Wasilla, Alaska, which
Yep.
is like an hour north of Anchorage, so
Yep.
pretty central Alaska. Still got very cold. Your listeners are probably know Celsius, so it got down to like -30 at some point.
Mm.
I remember my car battery didn't work for a couple a couple of days when I went on travel. I had
Yeah,
to take it
frozen
into the
engines. Yeah,
apartment to like warm down. But
been there,
but
done
I
that.
got right, right. But I got hired to go to Alaska to really work on the community health needs assessment and
Mm.
specifically the photo voice component, to really just capture new data and learnings from community and from members that probably have not been listened to before, that have not been engaged in a lot of the bigger research. So I did that there. I did a lot of program evaluation around various public health programs. I did work around youth homelessness and collecting data and facilitating meetings. And yeah, as I saw your face, like
Mm.
it's crazy to think about youth homelessness in Alaska. There are tent cities in
Mm.
Alaska. Think about that. Like I don't know how people survive, and it really is very, very sad. And just on the point here of like intersectionality, a lot of the youth that are homeless in Alaska are homeless because their parents kick them out.
Mm.
And a lot of the time it is because they don't have normal societal genders, or they have or different things like that.
Yep.
So I worked with a lot of LGBTQ plus homeless youth, and that was a very interesting process. And I think it just taught me you really have to build that trust. You really have to move slow with these communities. They have a lot of trauma that they've been through, and as well as them being in these professional type settings can be a little difficult, can be a little trauma inducing, especially when there are a lot of older professionals that don't really give them time and space to think and to share their voice. So that was a lot of the work that I did there. Was really, really grateful to be able to work in Alaska in a place that I never thought I would be, in a
Mm.
community that was very accepting. I was able to work with a couple of the Alaska Native tribes with the Photo Voice project, as well as with some of the evaluation work that I did. So it was a really wholesome experience.
Yeah, definitely. Yeah, it sounds awesome. Yeah, I would. It's definitely one of the ones on my bucket list. Go to Alaska. Yeah. Um.
Absolutely, yeah.
Yeah. Yeah. No. So I can't remember, but had you done a bit of volunteering at some point as well?
Yes, yes. I did do some volunteering. This was mostly focused on me trying to get into medical school. So I did volunteering at a couple different hospitals, one in Tampa and then one in Gainesville. And I enjoyed these experiences, but I think it really taught me that the healthcare hospital setting was not the place that I really wanted to be in. And I just saw how they treated people as I don't know. It was they kind of looked down on a lot of the people that were
It's
there,
the
and it just wasn't
biomedical
a
model of health. It's literally the whole reason that they do this is because of the biomedical model of health. So it's
exactly.
like a big one for me is like looking at things like eating disorders. I don't know how it is in America, but here in Australia, we're still. I mean, we're getting a little bit better now, but as I said, it wasn't like. But even then, it's still predominantly focused on females. There is nothing on like overeating and binge eating in males, even though like there's a huge, like a very high amount of males who binge eat and things like that. But because we don't talk about it, it's not it just doesn't exist. It's
Yeah,
kind of
yeah, yeah.
that thing, yeah.
Yeah, and,
It's
and I think just that was like real life experience of seeing, okay, they're really just treating the symptoms here, and
yeah,
like me being a volunteer and having like those candid conversations with people, just realized that there were so many other factors that were important in providing like in people getting their optimal health. And then I was able to go from that volunteering to fall right into public health and learn about the systemic inequities in the healthcare system, and that 20% of the GDP goes towards healthcare costs in the US, but yet they have worse outcomes than all other rich countries in
yeah.
the world, which blows my mind still to this day. But
Yeah,
here we are.
I've seen a few documentaries on that, and it's like, I mean, granted, you're like the top of the list when it comes to like crazy procedures, but it's like the actual physical lifespan is not like what was healthy lifespan is quite low, which is quite
Yeah.
sad. And like to kind of build on to what you're saying as well, like with like so I think it stems to doctors not learning or learning very little, if nothing, about public health and things like nutrition. I think because I'm a qualified nutritionist before I did this, and one that I came across when I was partly when I first went vegan, but also partly just like was looking at nutrition and stuff like that, was on average an American doctor only has about 20 hours worth of nutritional studies. Now you look at something like a cardiothoracic surgeon. This one blew my mind. The leading cause of death for a cardiothoracic surgeon is heart disease. You think someone who spends their days treating heart disease and putting stents in would realize that what they're eating is directly linked to the to heart disease. So it's
Yeah.
just like just as a random sort of said that issue where because they don't learn enough of what they actually need to know. It's just
Yeah.
yeah, it blew my
That
that
is
one really blew my mind.
that is mind-boggling, and I think it just speaks to, as you said, the biomedical model that doesn't really think about the root causes of things and how they come about. So yeah, I appreciate you sharing that.
Yeah, definitely. Yeah. So moving a bit on, kind of almost what we were just slowly starting to talk about there is more about like the what for people who don't know, a lot of people get very confused. What is the difference between health equity and health equality, and why is the distinguish important?
Yeah. So I know probably to this day, everyone's probably seen the little diagram of people standing by the baseball field and things like that. So just to say what health equity is, it is the systemic differences in health and health outcomes between different populations because of social conditions like where people live, work, play, age, and are born. So social determinants of health. And a quick example of difference between health equity and health equality. Okay, let's say we're going into a community to have a meeting around an environmental issue, and 30% of that population speaks Spanish. But in this meeting, they don't bring any translators to the let me start over
To
there.
the
So
meeting.
yeah, so there's a community meeting, and 25% of the population speaks Spanish. However, all the concerns and all the conversation is held in English. Though there was this community meeting, though that they were like creating this forum for people to have these conversations, it was not equitable in the sense that everyone didn't have the same level of access to the knowledge and the information that was
Yeah.
going on. So an example of equity would be here that The community leader hires translators to attend the meeting and offer additional meetings held in another language, so whether that's Spanish or another language, to ensure that all community members are able to access the information and are able to make informed decisions based on that information. So I think that's a simple
That's a
example
good
to
one.
show the difference.
Yeah. Yeah, no, definitely. It stems. It's like that reminded me of here when COVID started, and we were handing out like the Australian government and health department were handing out these flyers, and a lot of them weren't even spelt correctly in like say like if it wasn't like we have a lot of Middle Eastern people here, so like a lot of Arabic people who speak Arabic, things like that, and then they'd write the write it wrong in the language, or the Chinese, it's written completely like instead of being in Mandarin, it's in Cantonese, and things like that, and it's like just do some research and actually find out who the hell they're trying to work with. It's things like that. It's
and
just
and to that point, those are like organizational and more like systemic inequities that continue to exacerbate the issues that are there. Because if one group is getting correct information and the other group isn't, then it's just going to continue to force that gap and create more health inequities.
And that's exactly what we saw with COVID here in Australia. I mean, it's nothing like compared to America and things like that. But I was in Sydney, which was the second highest amount of COVID cases in Australia. Actually, might even been the highest, but we had less lockdowns and things. But for a while there, just before I moved here to Adelaide, where I'm studying, we had almost a 4 month lockdown, but it was only in certain suburbs. So like if a suburb had a high amount of COVID, and basically they ended up locking down the whole of most of the western side of Sydney, which is basically like the poorer, lower socioeconomic, a lot of immigrants, a lot of people who don't speak any English or any English in some cases. So yeah, things like that. We saw a lot of that sort of thing. Whereas because they didn't do because the government didn't do their job properly in the first place, it stemmed to so many other issues. It's just like And at that point, I just started learning about public health. So for me, it's like looking at this, it's like I haven't even got a degree, and I could do better than this.
And I think that's where a lot of younger public health professionals are standing now. They're seeing what exactly inequities look like, and COVID has been a great example of this, and ways in which to not engage community, and taught us that we need to be better about engaging community leaders and marginalized groups to ensure that they're at the table, that they're getting the information, that they are able to take in the information and share it with their communities in the best way for them, which as you said was not the case with wrong spelling and different things like that.
It's just stupid, like little things like that. It's like they can be so easily fixed, but they don't even do it, and it's like ugh. Well, it's like even the app. Like we have a COVID app. So if someone were to get COVID, and we scanned in QR codes through an app, and if someone in the building got COVID, you get a message sent straight to your phone. But even the app was all in English. There was no second language. There was nothing else, and it's like I think they changed it later, but at the start there wasn't, and it's like oh my god.
Yeah. Yep. Inequitable access to information. Happens all the time.
So I suppose, as we know, there's a big issue, especially in America, around racism, and racism is a public health issue. Why is racism a public health issue?
Well, I think it goes into all these conversations that we've just been having, because historically people have been othered because of their race. There's no scientific basis for race, but yet it is like one of the most important social constructs that we have right now, because communities have been othered. I want to say the declaration was made sometime in 2020 when like George Floyd was being murdered, Breonna Taylor was murdered, Ahmaud Arbery was murdered, as along with a host of other Black bodies and Black people that were killed by police officers. And it just really is a calling to say that we need to really think about these health inequities, these systemic injustices, and we need to not only think about them, but create funding and strategic action plans to address it. I would say that racism was always a public health crisis. It was always a public health issue. I'm happy that groups are naming it now, but I think what's even more important is that we're not only naming it, but taking the actions to move it forward. We're we're ensuring that we're having people most impacted by issues, most impacted by racism at the table, sharing their perspectives. Because I think where we are today as a society, I think as especially younger professionals, we see that there is a need for so much change, and the way that we have done things cannot be the way that we continue to do things, because it's not going to give us better outcomes. And I just wanted to be a little actionable on this racism as a public health issue. And I guess I could also talk a little bit about some of the health inequities that are baked into this racism as a public health issue as well. And I'll give a very like real one right now. So health inequities are baked into the social determinants of health. As we know, economics or economic stability is a big factor in social determinants of health, and people with low incomes tend to disproportionately be Black, and they're more vulnerable populations, more vulnerable jobs, especially in COVID. They had more disproportionate higher cases of COVID. They have less wealth than white families. But the real example I wanted to bring it to was gas and just gas prices. If we look
petrol,
at gas,
Sorry, Petrol
yeah,
in
yeah,
most other countries.
petrol, petrol and gas. So when we look at gas as a health inequity in itself, with gas pricing hitting like record highs, the gas bill for the richer families, so people that make 100,000 and more, only equates to about 2 to 3% of their budget or their spending, while compared to lower income families, it can go all the way up to 10%. It could be like 5 to 10%. And that in itself creates more issues, because then they aren't the transportation infrastructure to do a lot of the transportation to work or from work. There just aren't these ways for people to get connected to, and it's just harder for communities that have been disinvested from to to make a living, to live healthy, to buy healthy food, to get access to work, to get access to hospital and healthcare, and all these different things. Okay, so going back to the actionable part of racism as a public health issue, because I just don't want to come on here and just shout racism as a public health crisis and just leave it. I wanted to give people some actionable steps. So on the other side of racism as a public health crisis is the anti-racism movement, which anti-racism just essentially encompasses a range of ideas and political actions meant to counter systemic racism and oppression. It is structured around intentional thoughts as well as actions. So some steps that I just wanted to share with your listeners to be like more anti-racist in all our lives. And this is me, including me as a Black male. I think all of us have implicit biases. So the first thing that we need to do is be self-aware. Hold ourselves accountable, see what implicit biases we all have, and see where they stem from. And not just because you're Black, you don't have systemic, implicit biases. Everyone has biases, so we all need to check ourselves and see where we are, and see, okay, what are the things that we are actually doing in our lives and activities that are perpetuating racism or these inequities. Number two would be to hold others accountable and to call them out. I feel for too long in society, we've just let people say what they want to say, especially when it could be harmful in many ways. And we've come to a point, and I think Gen Z does this a lot better than other generations, is calling people out for the crap, for the crap that they're saying, which is good. Another step here would be to check your information biases. So all of us are taking in information from many different places, but we have to really think, okay, are we only listening from perspectives from cis white men? Are we like what are the perspectives and the information that we are taking in all the time, and how is this influencing our implicit biases and the actions that we take? And I think that is something that is very important. Like if you don't listen to a lot of people that are other than yourself, like outside of for myself, black, I try to listen to a host of different perspectives just to ensure that I'm not only falling into the feedback loop of everything that I see and everything that I think is okay, because then I'm unable to check my biases, and then I can perpetuate racial inequities. Um, another action step here is just reading and engaging in hard and true dialogues with people, because I think, and I would caveat this by saying that don't go up to a black person and want to have a conversation about racism without first you doing your research first, because it's just very tiring for a lot of black people to have to go through these conversations day in and day out while they're facing all these inequities in life. So do your research, find space and time and someone that you feel safe with to have these types of conversations where they can tell you honest feedback on your thoughts, and you can actually move forward from there. Um, another action thing that I think is important is supporting the work, arts, and businesses of people of color is hugely important, because as I stated earlier, there's a huge economic divide, and that economic divide leads into a lot of health inequities and health outcome, and the disparity in those health outcomes, or the inequities in those health outcomes. So ensuring that we're not only talking about these things, but putting our money, our time, and investing that into people of color, into black organizations, and to that point, try to become more involved in racial justice organizations and issues. And I think those are some great action steps to begin to move towards more equitable, less racist society.
Yeah, definitely. Yeah. And I suppose moving slightly, still talking about racism, but I had a more of a question for you. I don't know how much knowledge you have around like food systems and things like that. I know you said you did a bit with some African American farmers and things like that. But a question I had was, have you heard of Dr. Milton Mills?
I have not.
Okay, so he's a you should look him up. I might even send you a link to one of his videos afterwards.
Please do.
So I first came across him on, I think it was What the Health, one of those documentaries on Netflix about health and a lot about veganism and things like that. But an area that he talked about, which I found quite interesting, was milk, like dairy milk, as a racism issue, because 75% of the world is lactose intolerant, and the vast majority of them being people of color. I think last time I looked at it, it was about 85% of African Americans were lactose intolerant. Meaning, I just kind of find it interesting, like your thoughts on it as someone who's veganish, your words, on that sort of, on that more so, as I said, like almost like that, those sorts of issues from a black perspective, because I haven't really got a black perspective yet. So it'd be interesting to see what you think.
Yeah, that's quite interesting. I did not know the statistics. Just anecdotally, my brother, my cousins, myself have developed a little bit of lactose intolerance. I think as I've been more like plant-based in my eating, trying to eat milk, or that does not go well for my stomach.
Don't know if you can see the shirt, but
Dairy is scary.
Yeah.
Yeah. But I think that goes back to, and to preface this, and I don't know much about the research, but I know a lot of scientific research has been created to show that black people are inferior, to push all these things onto black society, and that has been a scientific basis for hundreds of years. So I don't see this as anything different from like food deserts, food banks. This was probably an intentional push for people who know that black communities aren't able to get nutrients from these types of milks, but yet they're pushing it out there to the communities, which is probably making them inflamed, making them go through other health issues.
There's actually a lot of other things that like it may be linked to because you can't actually digest the, like most even myself, even though I'm not lactose intolerant and I don't drink milk anymore, you can only digest a fraction of the calcium in milk. You're better off with a soy milk or something like that, which nowadays, I don't know in America, but in Australia, the per litre it's approximately on par. It might be slightly more occasionally, but in general, the home brand version costs the same, if not even sometimes a bit cheaper at the moment. With all
Yeah,
the
yeah.
floods that we've had here, I said a lot of our plant based foods right now are actually cheaper than the meats, which I think is quite cool. But yeah, just as I said, like, looking at those sorts of things, and just as I said, the other issues, like I was looking at it recently. This because of industry funded studies, which is the other issue in nutrition, especially. About
Hmm.
85% of all studies in nutrition are industry funded, and about 2/3 of them are skewed to to the industry or whoever funded its point of view. So looking at it that way, it's like, as I said, you can see a huge issue because where does the money come from? The meat,
Yeah,
dairy, and eggs,
yeah,
and all
yeah,
that
yeah.
sort of thing. So it's interesting to see that, like, just
Y-
yeah,
Yeah, and I'm guessing if we dig even more into it as well, you'll see that not only are they funding these studies, but they're funding the political campaigns of people that are
yeah,
running to ensure that milk is still out there. It's crazy that we as humans in 2022 still drink milk. We're the only animal that, well, milk from another animal,
yeah,
cow milk,
and
or
after
goat milk, or
adolescence
whatever.
as well. We're the
Yeah,
only
yeah.
animal that takes milk from another animal, and we're the only animal that drinks milk after adolescence. Which, like, when you think of it that way, and when you consider the other areas, like from the One Health point of view, I don't know if you have spent much time on that, but the One Health point of view, I said, like, if we look at it from that, like as I said, it's clearly linked. Every time we start playing and touching animals, we put ourselves at risk for another huge epidemic, especially the way we do it in countries like Australia and America, with our factory farms of chickens and especially pigs. As I said, like, I believe North Carolina has one of the highest amount of pig farms, and they're all
Yep,
surrounded by those black communities.
yep.
And yeah, so did you want to talk a bit about that? I know that you probably being in that area might know a little bit. So
Yeah, yeah. Interestingly, my boss shared with me one of the communities that I work in, which is rural Northeast North Carolina, was where the environmental justice movement actually began. Um, I can't remember specifically what it is, but I believe it was because of these pig farms because they have a lot of waste, and that
yeah,
waste is dumped into the land, and they're just huge environmental impacts not only on the land but on the people that are live there. And as we know, there's been redlining in the U.S., so people are forced into these certain communities, and then they will put all those pig farms with all the waste. They will put all the different factories that have all the other kinds of waste, and it is really crazy to think about. And that does not only happen in the US, but it happens all around the world for Black and other
yeah,
marginalized
definitely. We see it
communities.
more in, like, with slaughterhouses and things like that here in Australia, and in America as well, obviously. But generally, our slaughterhouses tend to be manned by, like, we literally just had a whole heap of Samoans and sort of Polynesian island people come into Australia recently to do slaughterhouse work because Australians won't do it anymore. So,
Yeah.
like, as I said, like, when we closed our borders, we actually made an exception for a hope of this Samoan and Polynesian island and Bali and all those sorts of areas, so they could come and work in our slaughterhouses. And it's interesting because the slaughterhouses in those are always one in those lower socioeconomic areas. They're never in
Hmm.
a rich area, and two, there's not many studies on it, but there was one study a couple of years ago on on the link between people who work in slaughterhouses and, like, drug use and domestic abuse and all those sorts of other issues as well. And it showed that those areas tended to be higher than
Yeah.
other areas, which I thought was quite interesting as well from that sort of public health point of view. It said, like, we stop doing this to animals and all these sorts of other issues. We then
Yeah.
have this whole rollout of, as I said, like, one, our better health. I don't know if you've seen, like, the that was called the was it the Sustainable Goals, the World Health
SDGs.
Organization.
Hmm.
Yeah, there's like 10 of them are directly related to animal agriculture, and it's like that because they all work on them separately as well. It's like if they were working on them together, they'd probably see a lot more links. Like it said, like world hunger.
Yeah.
It said like one I looked at was 85% of all grain is fed to animals, fed to factory farmed animals and things like that. And instead of fed to the humans, there's 11 billion animals on the planet, and most of them are factory farmed. All the ones that are factory farmed are fed grains instead of being fed to humans. So,
Yeah. Yeah. It's a
but
crazy cycle that we live in and crazy
yeah,
systems. And
definitely, like, all those sorts of things. It just blows my mind, like how it heavily relates to, like, especially in those heavily relates to the people, and the people who get it worse are the people in those lower socioeconomic areas, poor black people, even the poor white people. More so in countries like Australia, where we have less people of color in general, but as I said, like in order the Aboriginals and people and Torres Strait Islander people as well here in Australia and just all over. As I said, you can see it where obesity runs rampant in those areas.
yeah, yeah. And one thing I just want to highlight there, like uh, towards the end of Dr. Martin Luther King Jr.'s reign, he was pushing for a fight on poverty because he realized that not only poor black people who disproportionately suffer from these issues, but there are a lot of poor white people that suffer from these issues. And and poverty is like ingrained in not only racism side, but ensuring that people that are suffering and are oppressed come together and try to fight the systems that have been there has been important. And I think that economic side of things has been left out for too long, especially in the
Yeah.
conversation around health. But you need that economic part in order to be healthiest, especially in this capitalistic world that we live in.
Yeah,
So I
it's
just wanted to
like
put that out
yeah,
there.
definitely. It's like people realize that if if they put more money towards public health and education, the government would actually save money.
Yeah.
85, it's like 95% of heart disease is preventable. But what do we do? Absolutely nothing. In Australia, I think only 10 or 15% of our health money goes to public health instead of it being 50-50 or even 40, whatever it is, 40-60.
Yeah.
Said in, but we're so low on the public health side. Most of our stuff actually comes from NGOs and things like that because they're the ones who seem to actually do the work.
Yeah.
It's like,
No,
which I find really stupid. It's like you would
yeah.
save so much. Like the government would save literally billions of dollars a year. It's like
Yeah.
Australia and America have both of us have the highest rates of disease, heart disease followed by I think colon cancer. Colon cancer
Okay.
is also insanely preventable. So,
Yeah.
like looking at those sorts of things, it's like, it blows my mind. Like looking at those sorts of something as simple as a diet change and a little bit of exercise
Yeah.
could
Yeah.
literally change everything.
Yeah, absolutely. And I think it's not much different in the US. 20% of GDP spent on healthcare. I want to say 1% is spent on public health. And we see what that has given us in this society here. And I think there has been structural structural and systemic ways trying to shut down public health. Because if you look at public health back in the, I don't know when they banned cigarettes on like planes and stuff like that, but right now you don't.
The
I
early
think maybe
2000s, yeah.
60s, 70s.
Yeah, no.
No,
He's,
it's more recent. More,
yeah. I mean, in Australia, 2008 was I believe, was when they officially put a ban on everything when it comes to smoking. I think it was only, they said like late 90s, sort of thing.
okay, okay. But you see just how like important that was. That was a huge public health win, and since then it's been really hard to have public health wins because I'm
Yeah.
guessing that the people that are in power realize that they're not going to capitalize and get their capitalistic profits
Yeah.
off of the systems if they aren't able to shut down whatever public health issues it is and stop those things from happening. As we know, hospitals get paid from treating people, and
Yeah.
until very, very recently in the US, used to get paid per service as opposed to ensuring that the population is healthy and getting reimbursed
Yeah.
based on that, which is a fee for service is a whole other issue in healthcare
Yeah,
that we
definitely.
don't
Yeah.
have to talk about
It's like
today.
looking at the whole way. It's like Australia is really weird. I don't know if you know much about Australia's healthcare system, but we're one of the only countries in the world that have both public and private intertwined. So like in America, you would have private hospitals. I assume, if correct me if I'm mistaken, but in America, I believe it's like you have private hospitals, and then if you're lucky, you might get a couple of health clinics, which are more like free things. We have fully
Mhm.
public health hospitals, but we also have private hospitals, and they're directly linked. And it doesn't matter. So in Australia, we have Medicare, not Medicaid, and basically everything like within most things except for dental and mental health are funded to some extent by Medicare. It doesn't matter if even in general, a lot of private hospitals will still accept Medicare, which I think is really cool. So like yeah, like looking at that, like something as simple as that could very easily change some issues in America without meaning you still got to acknowledge other issues like the inherent distrust, especially for people of color, things like that. But yeah,
Yeah. And to that point, like health insurance being tied to having a specific type of job in the US is also like a huge barrier to that because, as we know, a lot of people on the front lines doing like retail, well, not retail, restaurants and stuff during the pandemic, they didn't have health insurance, but they're more likely to catch COVID. And it's just playing into those same systemic inequities, which is harming the populations that have the least to have the worst outcomes.
does America have a minimum wage?
There is a minimum wage, and it's varied by state. There is
Yeah.
a federal minimum wage, but then there's like state minimum wages. And
What's the point of
yeah,
the
don't
federal
quote, don't,
minimum wage?
yeah, I do not know. This country's weird, man. It's,
Yeah.
it's like a bunch of different countries come together in states and they
Yeah.
do their own thing in a lot of ways, which is interesting
Yeah.
in itself.
Yeah, no, I suppose just quickly as well, we'll touch on the public health millennial in a minute, but I just wanted to touch base on a few things that have been happening in America recently. As I said, one of them being the abortion thing happening with abortion. I don't know enough about it, but I've come across it a few times. What's the go with that? Are they trying to ban abortion again?
Yeah, essentially that is what it is, and I honestly would just state that go read some more because I definitely do not know all that
Yeah.
is going on. But essentially that is the case is that they're trying to take away it falling more into the pro-life place where they're saying that a baby is born from the time that the
Yeah.
sperm and the egg meet, which creates a lot of issues, especially I think for lower socioeconomic people who may not, and at the same point in time, we have to think about USA has literally the worst type of sex education. No, a lot of people just learn about abstinence,
Yeah.
and then and then they're saying, okay, abstinence, but then when you're having a baby, let's not do that there. And then even when you have these babies, they want to cut back all the funding, all these public programs to help people that are suffering, but
Yeah.
they're not allowing them to cut off the hardship of what having a baby consists of. And there's probably a lot more nuances in there. And I am not versed in this.
Yeah.
I was actually kind of not reading much about this when it was happening.
Yep.
But I'm definitely pro-choice, and I think that
Yeah.
and especially considering that a lot of people making these policies are white men, and they're just trying to
Surprise,
tell.
surprise.
I know they're just trying to tell women what to do with their bodies, which is
Yeah.
ridiculous.
Yeah, no, it's
Yeah.
and more specifically, old rich white men.
Correct.
Is that's the other thing you got to distinguish there. As I said, like that whole issue where it's like because the whole world is really run by old rich white men. You miss there's so many issues because of that. I'm kind of waiting for them to die out, which should be pretty soon, hopefully, for some of them. No offense to the old rich white men, but it means we can finally start getting some of the millennials and that sort of thing starting to get into like especially things like areas of public health. Like, I mean, I can't remember him, but the guy who has basically, I don't know if he's the head of health in America, hasn't changed since the HIV epidemic, and I mean we know how bad that went in America and how bad it's still technically endemic is probably a better term for America.
Yeah.
For that, as I said, instead of calling it what it is, blame instead of doing that, blaming people and calling it the gay disease and all these other issues, which had so many different issues. Like, as I said, people wouldn't get tested because of that. Whereas here in Australia, like, it's an interesting how like something as simple as how they, like how their government talks about it can change like how we go about testing it, how we go about talking about it, stemming from. And the AIDS epidemic didn't even really hit Australia for long because we treated it a lot better, which I think is just quite interesting. And the other one I had as well was what's your kind of right word gun control. As we know in America right now, we've been getting the news for was it? I think it was the week before last. It was 3 mass shootings in a week. Like,
yeah,
what's happening, bro?
I think it's the same issues. The rich white men with the money are the ones that are lobbying to say, oh, we need guns. There was this act, I can't remember the name of it right now. I want to say in the 90s that barred the CDC from studying gun violence. So the CDC has not been collecting data on gun violence, while the amount of mass shootings in the US has probably skyrocketed since then. I know there's a bunch of studies out now saying that, the case that people will say is like, give us our guns because then we can protect people if situations happen. But case and time, and time again, that has not been the case. And studies have shown that households that have guns are more likely to experience a murder or someone dying in it from that gun.
Or if you're using it to protect yourself, you're like, I think it's 8 or times more likely, obviously way more likely, like to get shot by your own gun in a like if you're in a home invasion or that sort of thing. As I said, I can't remember the statistic, but it's like way higher. You're more likely to get shot if you have a gun than if you don't have a gun. And then you've got the other issue in America, like some states with the open carry. So that's like, whose dumb idea was that? Like, no offense, but
I do not. I get it to some extent, and some people saying that they want to like do hunting and stuff like that. I could understand it. Like in Alaska, people do a lot of hunting and stuff like that. But being able to open carry your gun into Walmart, like there's no need for you to do that.
And in saying that, there's a difference between. I mean, I actually quite like guns. I'm a big fan of that saying people guns don't kill people, people kill people. But in saying that, I do think that the fact that it's so easy to get a gun in America, like Kmart and Walmart. I mean, here in Australia, if I were to get a gun, I would first need to get a gun license, which can take like a long time for some people. On top of that, you can't go into a shop and just point to that gun and say, I want that one. You actually have to, like a lot of the times, most places won't even have guns on display anymore. It's you look through a magazine at the shop, I want that one, and then a week later they'll have it at the shop for you. Like that's how sort of how restricted we are. We have things like mental health checks. Something as simple as that could as I said, like the sort of things it's like, and especially I think most of the shootings that have happened recently, like the big mass shootings, at least 2 of them have been considered as sort of racial orientated.
Yeah, racially.
So like
Yeah, yeah.
if something like as something as simple as a little mental health check happened, if I'm not, I don't know if you'll agree with that, we may have possibly been able to kind of prevent that from happening in the first place.
Yeah, absolutely. I think and to that point, like ideally, I have no issues with guns. But at this point in life, like we've seen that guns and people are getting access to guns when they do have mental health challenges. They do have preconditions in their mind, and they've actually like either written or said things online where they said that they're going to hurt people or they're going to hurt Black people. And I think to that point is we need to have better systems in place to really ensure that people that are getting guns, people that are going to be safe with guns and aren't going to use it for these nefarious type of schemes.
Yeah,
And
definitely.
time
Yeah.
after time after time, you would think that they would change the gun laws. And I want to say that there have been some changes, and there has been a lot more push for it now. But why now, when people have been
Yeah.
dying in mass shootings for decades and decades?
Yeah, definitely. Yeah. I think it was our second mass shooting we had, and straight away we were like, "Nah, we're cutting that shit out right now." And we basically started doing gun buybacks, all these other different things, and then not long after that, we started having like heavy like laws around it. Like most people can't even get things like handguns, automatic, anything that's automatic. There isn't a single shot rifle. I don't think can even be bought in Australia. So things like that, it's like something very like so I want to say very simple, but even here in Australia, I mean, like there's still a lot of people who own guns, but there's far less shootings because of just how I think it's partly how we learn about them. As I said, like a lot of people in America, it's like here's your first gun, go have fun. Here in Australia, it's like here's your first gun. Before you learn how to shoot it, you're going to learn how to clean it. Sort of thing, like as I like straight from like I said, the more military style of learning how to use a gun, learn how to use it before you actually learn how to shoot it. Is kind of that idea. And yeah, anyway, moving on from that, we'll finish off with the last two. What is the public health millennial?
Yeah, great question. The Public Health Millennial is a platform that I created where I'm just really trying to help public health people navigate their careers, connect them to the resources, create a community. And part of the Public Health Millennial, it started with a blog, which is my website, thephmillennial.com. There's a Public Health Millennial Network, which is a network of currently just podcasters podcasting around different public health topics. I have my own podcast, the Public Health Millennial Career Stories podcast, which I think you're an avid listener to. So thank you for that. There's a YouTube channel, the Public Health Millennial, Instagram, which is probably where most people know me from, and that's at the PH Millennial. There's also a LinkedIn page, the Public Health Millennial on LinkedIn, and yeah, I'm just a content creator there.
On LinkedIn as well.
Yeah, absolutely. So it's just a platform. As I said, I thought that public health was so cool, and that when I looked for people and things talking about it when I graduated from my MPH back in 2019, they weren't anyone. No one was doing it really. So I said, okay, this is a gap. Let me fill it. Let me talk about all the cool things that you can do in public health and just share that information.
Definitely,
and it's grown a lot from there.
So from that, would you say there's still a big need to like? I mean, I'm big. I actually agree wholeheartedly. I think there's a huge issue where we are probably the worst area of health when it comes to promoting. No one knows what public health is until shit hits the fan.
Correct.
It's an example of that, and then because they don't know about it beforehand, it basically makes it really hard to like promote it because they only know it from the bullshit that went on through COVID. Us pretending we knew everything when we really didn't, and they should have just said that. Something as simple like all those sorts of issues. Moving on from that, but like the as I said, I agree. There needs to be a huge push to promote public health, and that's something that's part of the reason I run my podcast as well. and hopefully I'll actually be going to school soon with my school to kind of help promote public health through for like younger people, which I think would be really cool if I can get to do that. I've been trying to push my head teacher to let me do that. So yeah.
Yeah, that definitely very needed, and I think some people might think, oh, the public health space is like saturated right now, but that's not the case. No one says that for the medical space. No one says that for all the doctors that are on Instagram.
Nurses.
They only like they only have nurses. They only have a fraction of public health people on there, and as we know, public health is just so broad. So
Yeah.
I think the more voices and the more perspectives that we get from people in
Mm.
the field sharing this, the better it is. So yeah, I'm glad that you have this podcast, and I
Mm.
hope that you can get out there and chat more with those young
Mm.
people and let them know that this is something that you can do. This is a way you can
Yeah,
improve the health
definitely.
of
Yeah.
not only yourself but your community.
Yeah, no, definitely. Actually, saying that, with you saying like the saturated field, to put in perspective, okay, there's I believe there's over 1,000 people in the nursing program here at Flinders University where I'm studying. Have a guess, just have a stab in the dark. How many people there are in the public health degree and the certificate combined?
50.
17. Sorry, 27. That's
Wow.
combined. Um, and
Wow.
and mind you, no one has graduated from this degree yet. It is so new that I mean I'm like essentially the first real student coordinator person for the public health degree, which I think is really cool. And to end, um, what has been well, and with two things. Number one, what has been the low light of your career?
Ooh, low life. I definitely think it was. So when I was in my master's of public health, I was trying to get health administration fellowships, so fellowships in like health systems. And I was rejected from four of those. I got a couple like follow-up interviews and stuff
Mm.
like that, but I was unable to get that. And at that point in time, it felt like a very low life. But in hindsight, that was really good in the sense that I'm glad that I didn't end up in a healthcare setting where I was working, but I was
Mm.
able to get my community health fellowship where I did a lot more community driven and
Yeah.
community centered work in Alaska. So that was definitely a low point for me, but in hindsight, it all worked out.
Yeah, no, definitely, yeah. And what has been the highlight of your career so far?
I, this is a really good question and a really hard one, and I sat down and tried to think of an answer for this, and I really just don't have a good one. But highlights that I really enjoy are like prior to starting this podcast, you sharing that you listen to this podcast. That means the
Mm.
world to me because when I started this, I didn't think anyone would care a damn about what I had to say.
Damn, you were
But
wrong.
but now people reach out and seeing like people comment on whether that's a YouTube video I post or leaving a review or messaging me on LinkedIn or Instagram and just sharing how appreciative they are for this and that they don't want it to stop.
Mm.
Those little messages all along the way have been like huge highlights for me and have really like shown me that I am where I need to be. I need to continue sharing this because it's helpful to a lot of people and people need this information. And I'm glad that I was able to start and do this. So all those little reach
Mm.
outs from people saying that I've helped them or that they've learned so much from things that I've shared are definitely highlights that I take into all the work that I do. And I'm just happy that I'm able to do this.
Yeah, definitely. Yeah, cool. So to finish up, once again, not in there. I apologize for this, but what has been the right? But what resources would you recommend for people either starting public health or just in general, like your in question essentially?
Yeah. Resources I definitely say
Mm.
follow me on Instagram at the PH
Yep.
Millennial, and then from
I'll add
Instagram you
links
can
to
have
them, obviously.
yeah, yeah, you can navigate to all the different resources that the Public Health Millennial has. I think getting active on LinkedIn is a great way because that was how because when I got into public health, I had no clue what it was, but it was just in my master's of public health, it was just 2 years of like learning not only the skills and skill sets, but like what people do in it. And LinkedIn was a huge resource for me. I would literally LinkedIn stalk people and look at their career progression, see what kind of skill sets they had. So I definitely recommend doing that. There's this awesome book called 101 Careers in Public Health by Beth Seltzer
My school has that, and I said I know one of the guys in it.
Yeah, now you get to interview him too,
Yeah.
and Heather Krasnut. I think
I
that
want to
book.
get her on at some point as well.
Yeah. Let me know if you need that connection.
Yeah, definitely. Yeah. I think I think I have connected with her on LinkedIn, that amazing tool.
Exactly, and that's another thing about LinkedIn. Is like you can listen to this interview, you can see something on news and see someone's name and hear the cool things, or even that What the Health podcast documentary that you're talking about. You can see people's names on there and connect with them on LinkedIn or follow them on LinkedIn and see the work that they're doing. And I think that is amazing. We didn't have that 10 years ago. So using that kind of resources, I think is great. But that book is a great way to better understand different public health careers, because as we know, it's a very vast and broad field.
Make sure you get the newest edition as well, because the other ones aren't. They're good, but they aren't overly helpful, as helpful as the newer edition. Okay. As well, just for people who don't know.
Okay.
So yeah, any other areas? Obviously, you said the podcast, your area. As I said, like LinkedIn.
LinkedIn, and I think outside of that, there are many public health creators on Instagram now that you can reach out to, and you can like just follow them to see more about what public health is, what you do in a public health job. Reach out to everyone. Everyone's very open to answering questions. To do that, I also started a Discord community called Community Health and Wellness. So if you'd like to join that, go to thephmillennial.com/join to join there. And that's really a community not only focused on professional development, but focused on your well-being as a public health professional.
Well, obviously.
Yeah, and networking and building that community, which is hugely important. So definitely get out there, reach out to people, have informational interviews, because I think the more conversations you have, the more nuanced information you know, the better it's going to be in serving you for your career.
Yeah, definitely. Yeah. So I suppose finishing up now. So thanks, Omari, heaps for being on the podcast. It was awesome. Yeah, thanks heaps.
Yeah, thank you so much for this opportunity. I'm glad that I can come on, and I look forward to having you on my podcast. Everyone, go subscribe so you can look out to see when Jamil is on my podcast.
Yep. All right. Cool. Thanks.